Most of the time, you go to places, they have these hand wipes, and it's places like the grocery store where people are using the same carts. And I noticed some of the stores now have these wipes right beside the cart going into the store, so you can wipe that off.
That's right. Some of the least clean places around are places where a lot of people are touching the same surfaces. And so shopping carts in the supermarkets are places where a lot of people come through,
and
they're touching the shopping carts,
Right.
and the viruses and the bacteria live on those surfaces. Generally, a virus will live on the surface for a couple of hours, but with a shopping cart, just as an example, a lot of people touch that shopping cart
Right.
throughout the course of the day, and they don't sit there very often. So it's always a good idea to clean off that shopping cart before you put your hands on it. If you can't clean it off, you cannot put your hands in your mouth or your eyes. So you have to make sure that you keep your hand away from your nose, your mouth, and your eyes.
And your eyes once you go shopping. You heard it now. You out there shopping. Hey, look, you better make sure that if you, even, I would think even if you use the wipes, you would still recommend that they not put their hands in the eyes and the mouth and the nose.
Right, because
well,
viruses,
how do you prevent kids from doing that now?
Well, kids is a whole nother story.
Yeah,
because most of the things we're going to be infected with are going to come through your mouth, your nose, or your eyes, especially things out in the community.
Right.
And so if you pick it up on the surface, unless you have a cut on your hand or some open skin on your hand, you're not going to make you sick by touching it. You're going to touch it and then touch your face, your eyes, your nose, or your mouth. Then it'll make you sick because it goes through your mucous membranes, the pink tissue inside your mouth, nose, or underneath your eye. So, but for kids, how do you tell a kid to keep their hands out of their mouth?
Yeah, right.
Stop picking up stuff off the floor.
And kids do that. Even if you wipe the kid's hands, he's walking around. He's touching everything he passes.
That's right.
He passed this. He put his hand.
That's right.
He touches everything.
That's
I was just watching some kids. I guess the lady had about 3 of them. And they were in a range of 2 to 6. And so the 2-year-old terrible twos, I call them. What happened? They have a tendency to touch and not to obey anybody, no matter what.
That's right. And for the kids, you want to make sure they learn to cover their cough. You cough into your sleeve, not into your hand.
How effective is that? I see people coughing into their sleeve instead of their hands.
Very effective.
Very effective.
Very effective. And the other part of prevention is making sure you stay home if you're sick, or keep your child home if you're sick. And so if you feel a little febrile, you got a cough, a little bit of body ache, runny nose, some diarrhea, just go ahead and stay home until you feel better. If your child or your grandchild is sick, just keep them home, because the more time they're out in the public, the more likely they're going to give somebody else whatever is making them sick.
So if you're sick, then that causes a problem. For instance, if a parent is not sick, and then the child is sick.
That's right.
Then they have to, if they're taking them to the babysitter or whatever, that means they got to stop that.
That's right. And the other thing for preventing is the vaccine. So we talked about the flu vaccines, but the flu vaccines are the most effective way for someone to minimize their chance of catching the flu. Now, recently we had this issue with the recall of the medication.
Yes, tell us about the recall.
And so there's a vaccine for different age groups. There's a special vaccine formulation for children between the ages of 6 months and 35 years of age, 35 months of age, excuse me. So children that are below the age of 3 for 35 months of age, there's a special formulation of the vaccine. That formulation of the vaccine has to have a certain strength to the medication. So all of the vaccines have a potency level or a strength level.
Okay, the strength level, is it affected by temperature?
It's usually not affected by, the vaccine has to stay in a certain temperature in order for it to be valid. That's correct.
Right.
But what the manufacturer, Sanofi Pasteur, has found, that there were 4 batches or lots, LOT, lot numbers of this vaccine. 4 of these lots that were, at the correct potency or strength when they were manufactured and shipped, they found over time that even if these vaccine packages were kept at the appropriate temperature, the potency or strength of the vaccine was diminishing. And that means that they found that they were just slightly below the recommended potency. So if you have a grandchild or a child that received that vaccine, they're okay and they will develop the appropriate immunity. But going forward, no one else can receive from those lots because the potency continues to drop as time goes on. When the potency or the strength drops,
how do you determine that? I mean, the average person, when they go get a shot, they have no way of knowing how potent
the only person who can tell that are the vaccine manufacturers and the federal government that have the ability
and that's
to
why
test
you
it.
have the recall.
That's right.
And how often are they supposed to check the vaccine that's coming out of their factory?
It's an ongoing, continuous process. And so they're continually testing all of the vaccines. And so the vaccines that are being recalled passed all of the appropriate
Original tests.
That's right. But then the government went back and retested them to make sure that, just like when you look on, you go buy something from the store and you get a container of milk. That container of milk has a shelf life for when that milk is safe.
Stamp,
It's a stamp on it.
Right.
And so the manufacturer knows that as long as you're within that time frame on the carton and you keep it refrigerated, you're going to be okay. What the federal government says is we're shipping you vaccines. That vaccine has an expiration date on it, but they keep some of it back and say, we're going to test this.
Periodically.
Periodically.
Okay. The health department get involved in that?
That's a federal issue. That's a CDC.
Federal. Okay.
Right.
Now, that's on the federal level.
That's right.
Now, do they work with the Prince George Health Department work with the federal people in checking the vaccine?
It's a relationship between the local government, Prince George's County, the state health department at the State Department of Health and Mental Hygiene, and the Center for Disease Control. So usually it's the federal government, state government, and then local government.
And they work together.
They work together. Right.
And periodically, what about volume? I was thinking in terms of after a certain period of time, the potency would deplenish too.
Well, actually, what
storage and where it's stored. If it's stored in an air-conditioned place or it's stored in an area that's not air-conditioned.
Actually, and it's a good question because there are specific storage requirements that the local government and the state government have to agree to in order for the Center for Disease Control to send medication. And so we have refrigerators, we have freezers, and based on the type of vaccine, we meet across the country, all of the health departments are supposed to meet the specific storage requirements for the vaccine. Even in this case, this recall was only for the pre-filled syringes. So the government and the manufacturers will make a vaccine, put it in a syringe. So the only thing when you go to the flu clinic, you just put a needle on it, give you a shot. You pop it. Now, there's also vaccine in what's called multi-dose vials. It's a jar of vaccine that the healthcare provider, they dip the needle in, draw it out. That one is okay. So the refill does not affect the multi-dose vial. The problem why many people want the pre-filled syringe that's already drawn up in the syringe is that small syringe does not have any thimerosal or mercury in the vaccine. So most of the
difference is the presence of mercury.
That's right. So the pre-filled syringe has no mercury or thimerosal. It's thimerosal free. The multi-dose vial has small amounts of thimerosal. Now, thimerosal has never been scientifically proven to cause autism or other problems. But a lot of people are concerned about mercury in the vaccine.
Sure. Mercury anyway.
Anywhere.
Yeah.
That's right. And so anyone that's received, children that's received the vaccine from the mercury in the thimerosal multi-dose vial